The debate over whether or not it is safe for breastfeeding mothers to take Sudafed has been going on for years. While some argue that the medication can cause adverse effects in breastfed babies, others contend that the benefits of taking Sudafed outweigh any potential risks. In this video, we will look at both sides of the argument and discuss what research tells us about safety concerns related to breastfeeding and taking Sudafed. We'll also provide tips on how to make sure you are taking the medication safely while nursing your infant. By understanding these facts and weighing your options carefully, you can decide if using Sudafed while breastfeeding is right for you. Is it safe for breastfeeding mothers to take Sudafed? Generally, yes, it is okay for most breastfeeding mothers to take Sudafed pseudoephedrine if they need relief from cold and allergy symptoms. However, it's important to ask your healthcare provider before taking any medication while breastfeeding. Sudafed belongs to a class of medications called sympathomimetic agents that can be passed to infants through breast milk in small amounts. Sudafed is generally considered safe for breastfeeding mothers, as only a minimal amount of the medication is likely to enter breast milk. This amount is not expected to harm nursing infants. What are the potential risks of taking Sudafed while breastfeeding? While Sudafed is generally considered safe for breastfeeding mothers, it can cause some potential side effects. These include dry mouth, sleep disturbance, and dizziness. It's also important to note that Sudafed can pass through breast milk to the baby, potentially causing irritability or restlessness in the infant. As with any medication while breastfeeding, always consult your healthcare provider before taking Sudafed. Additionally, always take the lowest dose possible to minimize any potential risks to both you and your baby. Are there any benefits to taking Sudafed while nursing an infant? While there is no definitive answer to this question, studies have suggested that combining Sudafed and breastfeeding may be beneficial in some circumstances. In a study of mothers of premature infants, mothers who used moderate doses of Sudafed while exclusively breastfeeding their babies had fewer episodes of blocked milk ducts and reduced the amount of time spent pumping each day. This suggests that Sudafed may be helpful in situations where milk production and flow are blocked. Are there any alternatives to taking Sudafed for treating cold or allergy symptoms in breastfeeding mothers? Yes, some alternatives to taking Sudafed while breastfeeding are: 1. Over-the-counter antihistamines such as loratadine and cetirizine are considered safe for breastfeeding mothers and may offer relief from symptoms like a runny nose, sneezing, itchy eyes, and throat. 2. Nasal saline irrigation or nasal sprays like xylometazoline can help clear a stuffy nose without being absorbed systemically into the body like Sudafed is. 3. Decongestant nasal sprays are also an option if over-the-counter antihistamines and nasal saline irrigation don't provide relief. However, prolonged use of decongestant nasal sprays is not recommended for breastfeeding mothers. 4. In some cases, a doctor may prescribe mild steroid inhalers to treat colds and allergies in breastfeeding mothers. It's important to discuss all treatment options with your doctor before taking any medications while breastfeeding. Your doctor can help you find the safest and most effective treatment for your symptoms. While there are alternatives to Sudafed, it may still be a safe option in some cases when approved by your doctor. What measures should be taken if a mother does decide to take Sudafed while nursing her baby? It is important that any medications taken by a breastfeeding mother should be discussed with her doctor before they are taken, even if they seem seemingly harmless. Her doctor can help her decide whether the medication is safe to take while breastfeeding and will have an understanding of any potential risks associated with taking it. If it is decided that Sudafed can be taken while breastfeeding, the mother should take it at a time when she will not be nursing her baby for several hours afterward. This is because Sudafed takes around 2 to 3 hours to reach its peak concentration in the bloodstream. If a mother takes Sudafed while nursing, she should wait at least 4 hours after taking it before nursing the baby again. This will help to ensure that the baby does not ingest too much of the medication. Does research provide evidence that suggests it is safe for a nursing mother to use Sudafed as a medication? Research into the safety of Sudafed for breastfeeding mothers is still ongoing. While it is generally believed to be safe to take this medication when breastfeeding, there are some concerns that it may reduce milk supply or pass through breast milk and potentially cause harm to a baby. One review of available research found that, while some studies reported no change in milk supply, other studies showed a small but significant decrease in the amount of breast milk produced. In addition, there have been very few studies conducted looking at the potential effects on babies who are exposed to Sudafed through breastfeeding. Overall, the research on Sudafed and breastfeeding is still ongoing. While it is generally believed to be safe for nursing mothers to take this medication, there are some potential risks that should be considered before taking any medications while breastfeeding. If you have questions or concerns about whether a particular medication may affect your baby through breast milk, make sure to speak with your doctor first. Don't forget to leave us a comment below and hit subscribe if you want more videos like this.